Dearest e-grader and delightful friends, a very good day to all of you. I'm Shankri Venugopal with student ID number 860-830-235272001. And today for our subject Introduction to Counselling ABPG2203, we will be discussing on the title Substance Abuse and Disability Counselling. For a brief overview, substance abuse is also known as substance use disorder, and it is the harmful or hazardous use of psychoactive substance. These include alcohol, illicit drugs, or even prescriptive medication. It typically involves using substances in a way that causes significant problem or distress, and it affects various aspects of an individual's life. Their physical health, mental well-being, relationships, work, and even academic performance. Substance abuse and disability counseling are intersecting in an area that require a specialized knowledge. People with disabilities may face unique challenges when it comes to substance abuse, whether due to social isolation, chronic pain, or accessibility to care. Recognizing the role of addiction and habituation in their lives can truly empower the counselor to provide the right support and allowing the individual to lead a more fulfilling life. Disability is a term used to describe either a physical, mental, intellectual, or sensory impairment. And in interacting with the environment and the social barriers that take place, this may hinder a person's full and effective participation in society on an equal level playing field. Disabilities can be visible as well as invisible. It can be temporary and it also can be permanent. And it can affect individuals differently depending on various factors, including personal characteristics, the support system, the family, and the societal environment around them. Now, you may ask, what is disability counseling? Disability counseling is a specialized approach where we focus on the unique needs and experiences of people, individuals with disabilities, including their mental health and their addiction challenges. According to the research and literature, a study on the prevalence rates of mental health concerns, including substance use disorders and comorbidity, among individuals with visual disability are higher than those of the general population. Now, counselors can play a dynamic role in treating clients with visual disabilities and many other disabilities and promoting greater life satisfaction. Substance abuse and disability counseling plays a crucial role in supporting individuals who face a combined challenges of addiction and disability. Substance abuse often is linked to various physical, psychological, and social impairments and can significantly affect an individual's quality of life, particularly for those with disabilities who may already encounter limitations on a daily basis. And counseling provides the support. The supportive environment where clients can understand the root cause of their addiction and develop coping strategies and work towards recovery. There are a few drug terminologies that we need to be familiar with, such as substance abuse, substance dependence, addiction, habituation, and dependence. Now, what is substance abuse? Substance abuse is the harmful or hazardous use of psychoactive substance like alcohol, illicit drugs, and also prescription medication, as I mentioned earlier. Substance dependence is, on the other hand, it involves the strong desire to take the drugs despite the harmful consequences that it presents. And let's look into addiction, habituation, and dependence a little further. And now let's talk a little about addiction. Addiction is often defined as a chronic and relapsing disorder where a person feels a compulsive need for that substance despite its harmful consequence. Addiction isn't just physical, it is also psychological, and it has many elements to it, making it complex and challenging to actually address. For those with disabilities, addiction can complicate their already challenging lives, affecting both physical as well as their mental health, of course. And counselors need to navigate these complexities. Next, let's discuss habituation. Habituation is different from addiction, though they are sometimes confused. Habituation refers to a gradual decrease in the response to a substance after repeated exposure to it. Unlike addiction, habituation doesn't necessarily involve physical craving or compulsion. It can still pose risks, particularly for those with disabilities who might rely on medication to manage pain and other symptoms that they may have. And understanding this distinction helps the counselors to approach the clients to meet their needs based on their disabilities as well. Now let's look at dependence. What is dependence? Substance dependence in individuals with disabilities present unique dangers, challenges, and concerns. Physical disabilities can often limit the body's ability to metabolize substance effectively, increasing the risk of adverse reaction to overdose. People with disabilities may use substances to cope with pain, isolation, or even stress. And the risk of dependence and creating a cycle of increased use and potential health issues are very high. Now let's talk a little about addiction and habituation based on different aspects. The definition of addiction. Definition of addiction is a chronic relapse disorder involving compulsive substance use despite harmful consequence. In habituation, the definition is a decrease in response to repeated stimulus without compulsive use. Now, based on the definition itself, we can see that addiction and habituation are quite different. Let's go further. Physical dependence. Physical dependence is when, in addiction, when the individual stops using the stimulus, they have high physical abstinence syndrome, which is characterized by physical symptoms such as headaches, diarrhea, irritability, stomach cramps, and many other symptoms. In habituation, there is no physical abstinence syndrome. Psychological dependence. In addictions, there is a high psychological dependence with strong cravings for the substance. In habituation, there is low or no psychological dependence and minimum craving. This means that there is a minimal emotional attachment to the thing or to the substance. Let's talk about tolerance. In addiction, tolerance increases with repeated substance use, requiring a higher and higher dosage to achieve the same effect. Often this leads to a higher risk of overdose as well as dependency. It's like a cycle where the more you take, that's when you achieve, when the individual achieves the effect that they want, but also their dependency keeps increasing. It's a never-ending cycle. In habituation, tolerance may develop depending on the substance, but it's usually mild and doesn't lead to increase or compulsive usage. The individual's response to the stimulus decreases, but they can also stop without craving for more. Let's talk about the impact of these addiction and habituation on behavior. In addiction, it leads to compulsive, uncontrolled behavior to obtain and use the substance, meaning that the individual becomes more and more compulsive and the need to use the substance literally eats them up. In habituation, behavioral impact is very mild and the behavior can be stopped at will. Now let's talk about the health consequence. For addiction, serious health risks are posed, including physical and mental as well as social harm. In habituation, there is a very limited risk as long as the usage is not compulsive or harmful. An example of addiction is substance usage disorders such as alcohol, opioids, even nicotine. Smoking is highly addictive. And in habituation, it is the repeated action of drinking coffee in the mornings, but not needing it to function as a person through the day. Now, these are certain aspects of addiction and habituation that we can compare and we can understand. This gives us a clearer idea of these two distinctions, as well as maybe if there were similarities among these two. Now, let's explore some counseling techniques for substance abuse and disability. There are many out there, but let's focus on a few. Group counseling, cognitive behavioral therapy, motivational interviewing, and community counseling. Now, group counseling provides peer support. It reduces the isolation that these individuals face quite frequently, and it promotes a sense of accountability. This takes place by these individuals sharing their experiences and challenges with others that face similar issues as themselves. This gives them some space for growth as they self-reflect, and they also broaden their horizons. Cognitive behavioral therapy helps clients identify and change harmful thought patterns and reinstating it with better coping mechanisms, fostering healthier mindsets and leading to a better quality of life. Motivational interviewing builds clients' intrinsic motivation for change. This is by enhancing their commitment to their goal. They have a deeper sense of understanding of what is their motivation from within, and they are focused towards a commitment to their treatments. Community counseling provides accessible, culturally relevant support within a very familiar settings of their community itself. This can involve family and community networks for added support, and this gives the individuals continuous care and gives them space for continuous growth and acceptance. These statistics are by the Australian Human Rights Council, and as we can note, individuals with disabilities face many challenges. Simply coping with daily life can be a challenge, and substance abuse should be minimized in order to provide them the opportunity of a fulfilling life. Comprehensive support that incorporates informed care, access to social services, and socioeconomic advocacy is essential in fostering recovery and improving their quality of life. To conclude, understanding the complexities of substance abuse and disability counseling is essential for providing effective support to those in need. By recognizing these key terms, distinguishing addiction from habituation, and applying appropriate counseling techniques, we can together foster healthier coping mechanisms and aid in recovery. Together, through compassionate and informed care, we can make meaningful impact in disabled individuals' lives and communities affected by substance abuse. Thank you, and I hope you enjoyed this video.